Please stand by. Good day, everyone, and welcome to the NCD Alliance webinar. Today's conference is being recorded. At this time, I would like to turn the conference over to Katie Dain, Executive Director of the NCD Alliance. Please go ahead.
Thank you. Good morning or good afternoon, everybody, and welcome to this NCD Alliance webinar on the 6th of June. Today we are focusing purely on the World Health Assembly, which took place just a couple of weeks ago in Geneva. And for many of you that were either in town or not, you'll all be very aware that this WHA was a really important one for a number of different reasons. Firstly, it was obviously the election of the new Director General. Secondly, from an NCD perspective, it was a really important one this year because it really marked the start of the countdown towards the 2018 UN high-level meeting on NCDs, as well as covered a lot of different specific NCD issues such as a cancer resolution, a dementia action plan, and many other NCD-related items during the week. And thirdly, it was an important one because it really marked a transition for the NCD Alliance as an organisation. It marked us becoming an NGO, not-for-profit association, registered in Switzerland. So during the week, it was an extremely busy week, and it was great to see so many of you on this webinar in Geneva as well. So in terms of, if I go back to, that's fine. So in terms of the agenda, we are focusing on WHA, so we're going to be talked through the official agenda items by Alena Matzke from the NCD Alliance. We'll just touch briefly upon one specific issue that was a really important focus area for us as the NCD Alliance during the week, which was financing for NCDs. Secondly, we will hear an update on the cancer resolution that was going through the World Health Assembly from Rosie from UICC. Thirdly, we'll be hearing from Joanna Markbreiter from the World Heart Federation to give us an update on the rheumatic heart disease resolution that was discussed at the EB straight after WHA. And then finally, I'll just be giving you a very short update on the WHO Global NCD Conference that's being held in Uruguay later this year. So with no further ado, let me pass over to Alena, who will be walking us through the many official agenda items of WHA. Alena.
Thank you very much, Katie, and welcome everyone to this post-WHA webinar. Could I go to my first slide, please? The next one. Great. So I will be kicking us off with just a quick look at the beginning of the week, which started with Dr. Margaret Chen's last welcome address to the World Health Assembly. As you know, she's been in her role since 2026, and she used her last welcome address to look back on this decade of shaping global health policy. She had some very strong words about civil society saying or calling on member states to listen to civil society. Civil society organizations are society's conscience, and adding here that civil society is really best placed to hold governments and businesses like the tobacco, alcohol, and food industries to account. She also said that the trend that most profoundly reshaped the mindset of public health was the rise of NCDs. This shift in the disease burden called for a move away from the biomedical model of health and its emphasis on curing diseases to a much broader approach based on prevention. She added quite a couple more points on NCDs, for example, saying that the recommendations she most wanted to see implemented were those made by the Commission on Ending Childhood Obesity, acknowledging that childhood obesity is the most visible and arguably the most tragic expression of the forces that are driving the rise of NCDs, and an early sign that trouble in the form of cancers, diabetes, etc. are on their way. Next slide, please. And as Margaret Chen was looking back, the main focus of attention was certainly the election of the next Director General. On Tuesday the 23rd, after 3 rounds of voting, it was announced that Dr. Tedros Adhanom was going to be the next Director General of the WHO, and he will be taking office on the 1st of July for a 5-year term. For those of you less familiar with Tedros, he has a very strong focus on universal health coverage, in particularly access, as he made very clear during the week already, attending, for example, a technical briefing on universal health coverage and having very, very strong words on UHC, and again, as I said before, very much stressing the importance of not just looking at coverage, but also looking at access. And since his election, we've observed that he's taken a much stronger stance on NCDs. During the WHA, he called NCDs a perfect storm, a silent killer in the making, affecting all regions and all income levels, costing us dearly today, which will only worsen if we don't shift and reverse the trajectory. And I attended an event with him and the president of Uruguay, Tabare Vázquez, this morning, and he seemed very energized there as well, saying that NCDs is a fight we must fight, and acknowledging that NCDs are a threat to the whole world. So quite exciting from an NCD's perspective. Really good to see him taking a strong stance early on. Next slide, please. Moving right on to the next one. All right, so I'm going to start just by looking at where NCDs were on the agenda of the 70th World Health Assembly. Just in terms of numbers, there were 8 NCD agenda sub-items. Of course, NCDs are of cross-cutting relevance. I'll be touching upon a couple of agenda items that are not NCD specific, but where NCDs play a big role as well. There were more than 26 NCD-themed side events, which is a really large number for everyone who's not familiar with the World Health Assembly here on the ground. And in the end, we had 2.5 full days of official NCD discussions, which is quite significant, knowing that the World Health Assembly really only began its thematic discussions on Wednesday the 24th, and then closed or ended the thematic discussions on Tuesday, the 30th of May. NCDs were also among the top 5 hashtags on Twitter for the 70th World Health Assembly, and we're very pleased to see NCD Alliance among the top 5 Twitter accounts mentioned by others linked to the World Health Assembly. Really strong wins for NCDs at the World Health Assembly, and the executive board that followed the World Health Assembly was the adoption of a resolution on NCDs, which includes endorsement of Appendix II. I'll be talking about this in a second. The endorsement of the Global Action Plan on Dementia, the adoption of the 2017 Cancer Resolution, and also the proclamation of SMART commitments against the UN Decade of Action on Nutrition, and then lastly also the adoption of a resolution on rheumatic heart disease at the Executive Board last week. Next slide, please. And so at our side event on success factors for NCDs on Monday, the 22nd of May, Richard Horton proclaimed that it was a golden moment for NCDs, pointing on the one hand to NCD Alliance becoming an NGO, and then also referencing the large number of NCD side events and official agenda items. And while I myself went into this World Health Assembly wondering how prominent NCDs would be, I now look back to say that they were actually really prominent, and I really noticed, or I may be wrong, but I feel like that the tone and the sense of urgency in member state interventions on NCDs and related issues has changed, perhaps reflecting really this shift in focus away from just the global NCD architecture and global processes to the national implementation piece. Next slide, please. For us at the NCD Alliance, this World Health Assembly was also quite significant and a little bit different because we had a really strong presence of national NCD advocates. We had representatives of 10 national and regional NCD alliances here in Geneva, which was really wonderful. We launched a new initiative called Our Views, Our Voices, which intends to really increase the meaningful involvement of people living with NCDs in the NCD response, with the first consultation phase taking place this summer. And we hosted what we call the Geneva Fly-In. It was a weekend-long workshop for the advocates of our new accelerator program, which is basically alliances from Brazil, Mexico, Colombia, South Africa, and India. And so the weekend preceding the WHA, we held in an advocacy workshop to share in-country experiences and make links between national and global advocacy. Having these advocates here in Geneva, we also had an opportunity to give them a platform for showcasing their national advocacy. So we had Paula Johns from ACT Brazil, ACT Health Promotion from Brazil, speak at our side event on success factors for NCDs. And during the World Health Assembly, we also had the first meeting of an internal food and nutrition working group, given that most of our accelerator alliances are largely focused on food and nutrition issues, and this group will be working throughout the course of the accelerator program to tackle food and nutrition related policy issues together. So very exciting for us to see this national advocacy piece connect much more prominently with the work that we do here in these global fora, such as the World Health Assembly. Next slide, please. Next slide. So moving on to the official World Health Assembly discussions. On the agenda for NCDs was certainly the election of the Director General, and then under the agenda item 15 on NCDs, we had 8 sub-items, some of which I will be talking to in greater detail. Just to say here that my colleague Rosie Tasker from the UICC will be covering the cancer resolution after I finish my presentation, and then we have the great pleasure as well to be talking about rheumatic heart disease and a resolution that was adopted at the Executive Board, and our colleague Joanna Markbreiter from the World Heart Federation will be talking after Rosie on this topic. For everyone who wants to read up on WHA documents and resolutions and decisions that were adopted, there's a link here at the bottom of this slide, and some of the decisions and resolutions haven't gone online, but they should all eventually be uploaded to this link. So if you don't find a decision or a resolution and it's not hyperlinked in my presentation, that is because it hasn't been uploaded to this side. Next slide, please. All right, so kicking off with 15.1, which is on the preparations for the 2018 UN high-level meeting on NCDs. This is the sub-item on NCDs more broadly, and under this sub-item, member states adopted a resolution which is actually available already, and it's hyperlinked on this slide. The link will be live once we conclude the webinar and we share the slides with you. And this resolution endorsed the updated Appendix III of the Global NCD Action Plan. I'll come back to this in a second. It notes the work plan of the Global Coordination Mechanism on NCDs for the period 2018-2019. It urges member states to implement international commitments, taking into account the updated Appendix III, and to support the preparations for the 2018 UN high-level meeting at national, regional, and global levels. And finally, it requests the WHO Director General to submit a report on the preparations for the 2018 UN high-level meeting to the World Health Assembly next year in 2018. Next slide. All right, so the discussions on NCDs started with this agenda item 15.1, and very soon it became clear that we were looking at a little bit of disagreement about the endorsement of a document called Appendix III. We've been talking about Appendix III on previous webinars, so I don't want to spend too much time explaining what Appendix III is, but just as a background for those less familiar, Appendix III is WHO's set of cost-effective interventions for NCDs, sometimes also called the best buys, the WHO best buys on NCDs. And the original Appendix III was adopted by member states as part of the Global NCD Action Plan in 2013. It was always intended to be a living document that would be updated over time, and this update, this first update was undertaken last year, and so at this World Health Assembly, member states were presented with the updated document for endorsement. There was very strong support for endorsement of the updated Appendix III and the regulatory and fiscal measures that are contained within the updated document. For example, Barbados called it a lifesaver, lending its strong support to endorsement of the document. But we saw opposition from the U.S. and initially also from Italy to the endorsement of Appendix III. And the reasons that were given in the member state interventions were that the U.S. questioned the scientific evidence supporting certain interventions that were newly included in Appendix III, such as taxation of sugary drinks. It also had some concerns around the language of subsidies, highlighting here their international trade obligations, and then proposed an amendment that would only note the document, not endorse it. And additionally proposing that a new paragraph would be added to the resolution, which would, amongst others, note that some of the that interventions proposing taxation, for example, would be without prejudice to the sovereign rights of nations to determine taxation, among other policies. Next slide, please. All right, so what we saw then was the setup of a drafting group, which was tasked to find consensus on the NCD resolution, and it was quite a lengthy negotiation process, reflecting really strong leadership by countries from across all WHO regions that were not willing to go with anything less than full endorsement of the Appendix III. And then following the recent trend to withdraw from international negotiations, the U.S. dissociated themselves from the resolution. So the resolution was in the end adopted by all member states, but the U.S. took the floor again to dissociate itself from endorsement of Appendix 3. And if you want to read a bit more about this, there's a link here included to an article about what happened here behind the scenes. Another topic that member states commented on in their interventions on NCDs and on the report that was presented to the WJ. Of course, Appendix II was just one point in that report. So member states welcomed spoke to the preparatory process for the UN high-level meeting, showing themselves supportive, and in Uruguay announced that their president, Tabaré Vázquez, was going to host a global conference on NCDs in Montevideo from the 18th to the 20th of October, and this is part of the preparatory process for 2018. Katie will speak a little bit more about this conference, which has the theme of increasing policy coherence for NCDs later in the webinar. Next slide, please. There was also a really interesting call to walk the talk at the 2018 UN high-level meeting with Suriname, calling for the high-level meeting to show that member states are serious about taking action on NCDs and risk factors, highlighting that actions speak louder than words, and proposing that the UN headquarters in New York should be made entirely smoke and alcohol free for the time, for the duration of the high-level meeting in 2018, to show the world that countries are serious when talking about NCD-related risk factors. And just to list or just to mention a few recurring themes that we observed during member states' interventions, there was frequent mention of interference from the food and beverage, alcohol and tobacco industries at the national level. A lot of member states highlighted the need for regulatory and fiscal as opposed to voluntary measures, and there were several calls for technical assistance, countries highlighting their need to build capacity, and also strong concern voiced over lack of funding for NCDs. And this is really both about the funding of WHO's work at the global level, which, by the way, was just cut by 10%, and the funding gap for NCDs at the domestic level. It was quite interesting, for example, hearing I think it was Ghana speaking on behalf of the African region, highlighting the significant lack of funding for NCDs in the African region, and specifically mentioning concern over industry interference, in particular with regards to measures that could mobilize funds for NCDs domestically. Next slide, please. All right, another interesting development at the World Health Assembly was a call for a review of the global strategy on alcohol. Sri Lanka is supported by the 11 member states of the Southeast Asia region, as well as Norway, Estonia, Latvia, and Lithuania, called for urgent attention by the WHO to the harmful use of alcohol, and specifically requested that the WHO Director General initiate and resource an expert committee to report on the alcohol control situation and progress made prior to the UN high-level meeting in 2018, and called for a need to review the impact of the 2010 global strategy to reduce the harmful use of alcohol. In addition to that, Botswana, Panama, Zambia, Canada, and a number of other countries mentioned specific concerns that they had regarding alcohol-related harm, and again here also highlighting the challenge they are facing with industry interference blocking the implementation of alcohol control policies for example, related to taxation and marketing. Next slide, please. After about 10 years of advocacy, this World Health Assembly was quite significant for the dementia community, celebrating the adoption of the global NCD action plan. For those less familiar with the plan, this plan really makes dementia a priority for all 194 WHO member states and includes the fundamental acknowledgement that dementia is not a normal part of aging, and that those affected with dementia should be empowered to live as well as possible. The plan is a commitment by member states to initiate a strong public health response to dementia with time-bound targets across 7 action areas. Just a reminder here that dementia currently affects 50 million people worldwide, and this number is expected to triple by 2050. Significantly more than half of all people with dementia live in low and middle income countries, where as few as 10% of individuals receive diagnosis, and currently only 29 of the 194 member states of the WHO have a plan on dementia, which is hopefully something that will change significantly with the adoption of this global action plan. As the next step is obviously development of national plans, national targets, with costs, with budgets attached to these. Next slide, please. Quite significantly, a lot of member states spoke on a report that basically highlighting progress since the 2014 International Conference on Nutrition. I personally was quite surprised to see a very large number of member states speak on this agenda item, many of which reaffirmed their commitment to the UN Decade of Action on Nutrition, which was proclaimed in 2016. Many member states re-emphasized the need to address the burden of NCDs under this agenda item, and again, was very strong mention of the importance of addressing conflict of interest issues. 2 member states, Brazil and Ecuador, made very ambitious, smart commitments to the nutrition decade. For example, Brazil committed to, by 2019, and this is really only 2 years away, to stop the growth in the adult obesity rate in Brazil, and to reduce by at least 30% the consumption of sugar-sweetened beverages among adults, as well as to increase the intake of fruit and vegetables by at least 17.8%. So very ambitious commitments made here. Norway also announced the creation of a sustainable fisheries action network, which was an interesting point here, making that connection to the different SDGs beyond SDG 3, here touching on 1, 2, and 14, and supporting the multi-sectoral and broader food systems approach that the ICN2 contributed to the nutrition discussion. And the FAO in their statement at the World Health Assembly reminded us that if we don't change this trajectory, obesity will affect half of humanity by 2030. Next slide, please. After the discussions on Appendix III, the discussions on the implementation plan on ending childhood obesity were quite controversial again. The implementation plan on ending childhood obesity was developed to implement the recommendations of the WHO Commission on Ending Childhood Obesity, with the aim to reverse the increasing incidence of childhood overweight and obesity. And while there was once again very strong support for endorsement of the plan, the U.S. voiced their opposition to endorsement of the plan, and once again a drafting group was established which convened for several hours, and then in a consensus decision decided to welcome, not endorse, the plan, and to urge member states to implement national responses. The sticking points here were essentially the same as with Appendix III. It was concern that from the U.S. that the plan was too prescriptive, and again, those concerns over regulatory and fiscal measures that are included and recommended by the plan. It's worth noting here, though, that there was a slight difference with regards to the Appendix III negotiations and the negotiations that took place on the implementation plan on ending childhood obesity. Appendix III had already been adopted by member states as part of the Global NCD Action Plan, providing a lot more or a much stronger base for those member states that wanted to see the Appendix III endorsed than in the case of the implementation plan on ending childhood obesity. Since the plan is based on recommendations that were made by a high-level commission, it's not the same as a document such as Appendix III that was previously negotiated by member states. And while many member states from across all WHO regions until the very end really pushed for endorsement of the implementation plan, in the end, member states felt it was more important to find a consensus here. It's worth noting that a lot of the discussions that took place in the drafting group were also on the details of reporting, and the decision, which unfortunately isn't online yet, calls for regular reporting on the plan and for alignment in the reporting on NCD targets, the WHO 2025 nutrition targets, and also the reporting that takes place in the context of the Sustainable Development Goals. It's worth noting here that there's still some clarity to be gained around how the reporting on the plan will actually look like. The plan itself mentions that the Secretariat will develop a framework for evaluating progress on the implementation plan, which would define baselines, indicators, and responsible sectors. And you may remember that this has been something that we have been following very closely because we didn't think that the plan had a sufficiently robust monitoring framework attached to it. And the plan does foresee, though, that civil society and academia contribute to the development and implementation of monitoring accountability mechanisms for the plan. So we'll remain really involved here and hope to update you in the future on the development of this framework for evaluating progress on the implementation plan. So while we would have hoped to see this plan endorsed, we're still really encouraged that the plan, as was submitted to the World Health Assembly, was welcomed, and that member states now have a really strong global plan to model their national plans and strategies on. Next slide, please. All right, now moving on to the agenda items that are not NCD specific but related nonetheless. During the discussions on the health of refugees and migrants, member states noted that if universal health coverage was to be achieved, it was really essential that refugees and migrants are able to access care. Many member states highlighted that health is a right for all, and emphasized that refugees and migrants are especially vulnerable here. Turkey, for example, in their intervention, picked up on something Margaret Chan had said in her address to the World Health Assembly, and that was behind every number is a person, and that it was really important that we didn't forget the people that are behind the numbers in the refugee and migrants crisis. Many member states emphasized the fact that it was necessary to strengthen whole health systems in order to ensure that health systems could be extended to cover refugees and migrants, and several member states made specific reference to the need to address NCDs, but also very important mental health alongside other health priorities that affect refugees and migrants. The International Office for Migration requested that the forthcoming Global Action Plan for Refugee and Migrant Health should be aligned with the NCD Global Action Plan. Again, quite an important point here. In the end, the World Health Assembly adopted a resolution which, amongst other things, requests the Director General to identify best practices, experiences, and lessons learned in order to contribute to the development of a draft global action plan, which will be considered for adoption in 2 years at the 72nd World Health Assembly. Next slide, please. As always, for us, it's always quite important to follow anything related to the 2030 agenda at the World Health Assembly. A variety of member states mentioned NCDs specifically in their statements. Norway specifically even mentioned alcohol reduction, traffic injuries, and air pollution. Poland promoted its work on NCDs, in particular as it relates to tobacco control, and Sri Lanka spoke to the need for more data on household and ambient air pollution, also speaking to tobacco control, and the need to address alcohol as a global issue. The report that was a report that you can access here, that was noted, and a decision adopted by the World Health Assembly for the WHO to report every 2 years on progress. Next slide, please. An agenda item that we've been following much more closely as it relates to the NCD Alliance's work on NCDs and environmental health is the role of the health sector in the strategic approach to international chemicals management. In their interventions, member states expressed support for a roadmap that was adopted at this year's World Health Assembly, and noted in particular concern over the dangers of persistent organic pollutants and pesticides. This is really kind of a new area that where we see increasing linkages made between the NCD agenda and this problem of harmful chemicals as it relates to pesticides and the broader agriculture and food systems, but also the broader environments within which we live. So as I said, the roadmap on the role of the health sector in the strategic approach to international chemicals management was adopted. It includes 4 sections spanning from risk reduction to building institutional capacity, building up the knowledge and evidence base, and taking in greater leadership and coordination from the part of WHO and member states. And it's quite nice to see that the WHO team working on chemicals is particularly open to working with civil society. There was an informal meeting on the sidelines of the World Health Assembly to discuss opportunities for concrete collaboration on different areas of the roadmap. So if any one of you on this webinar is doing work on NCDs and chemicals, please do reach out, and we'd be happy to involve you more closely in these discussions with the WHO Secretariat. I will pause here for questions that have come up.
Thanks very much, Alena. Really great presentation and lots of really interesting insights on what was an extremely dense NCD agenda this year at the World Health Assembly. Lots of different issues discussed that obviously relate directly to NCDs and ones that were obviously very much linked to what we focus on. So we've had one question come in, and I've got a whole list of them, but we'll focus on the ones that are coming in. So please, if anyone on the line has questions, please do type them into the chat facility there. So we've got a question from Ibtihal Fatil, who is one of our new NCD Alliance board members. Her question is around Appendix III. So what's the anticipated role of the NCD Alliance in supporting member states to actually implement the interventions in Appendix III?
Oh, good question. I mean, I think our role really started at the World Health Assembly. We were really quite concerned to see the pushback on Appendix III, and so we talked to a lot of member states ahead of the discussions on Appendix III to make them aware of the opposition, and in these discussions with member states, it was a really great opportunity to actually sit down and exchange on Appendix. I think one of the roles that NCD Alliance certainly has is in kind of increasing awareness of the document. The name Appendix III certainly doesn't help promote its essential role in for member states. So I think one of our roles is certainly increasing awareness amongst our national and regional alliances, but also directly in our interactions. I think we've started this year with our event on success factors for NCDs. This facilitation of discussion of how to best implement the different interventions included in Appendix III, and I think that's certainly something we should be facilitating much more. So bringing Appendix III into the limelight and facilitating discussions on success factors and challenges to implementation. But then obviously a lot of the work that the WHO does at the global but also at the regional level is really focused around addressing these critical success factors and challenges, and with their technical expertise, they're perhaps better placed than us to directly work with member states to implement Appendix III. Katie, I don't know if you want to add anything here.
Yeah, I think it's a great question, and I think the negotiations during the World Health Assembly just reinforced to us all how important that document is. I mean, as Alena says, the actual title is absolutely awful, and I think we should all try and support a bit of a rebranding of Appendix III to actually come up with a name that means something to everyone rather than just us on this line, for example. But it's obviously a key document that all governments are using to really base their planning when they're developing national NCD plans. So, we as a civil society alliance, and many at the national level, obviously most importantly, can play a key role in the awareness raising of those interventions, the advocacy of their uptake, and also really reinforcing kind of good practice of what's working and the best way of implementing them, really. Let's move on to the next question because they're coming through thick and fast now. We've got a question from Deanna McGee from the American Heart Association. Obviously, based upon what you were saying earlier, Alena, about the U.S. government's particular role in trying to potentially kind of reduce the impact of the adoption of Appendix III? What can US coalitions like the NCD Roundtable do to kind of stress the importance of Appendix III?
That's a good question. I do think that it would be very important for the NCD Roundtable to come up with a position on Appendix III. Of course, one of the most basic things is to highlight the importance of Appendix III for NCD prevention control around the world, but also specifically in the U.S. I think there is a conversation or perhaps a position that the roundtable could take, for example, on taxation of sugary drinks. We see sugary drinks taxes being implemented by city governments, but there was very strong. We understand that a lot of the resistance that we saw against Appendix III was specifically on the taxation of sugar drinks, which is included in Appendix III as a cost-effective measure for member states. So, I mean, the U.S. government made it very clear that it wasn't willing to endorse a document that was that had taxation as a reference. So I think kind of whether it's an opinion piece, a direct advocacy, asking for a meeting with HHS is all very welcome. It's a very delicate matter, but it was quite concerning to see the U.S., for example, not just in the context of the Appendix III, but in the context of the implementation plan on ending childhood obesity, say things like all foods can be part of a healthy, balanced diet. This is a slogan that is used by industry usually, and not the kind of industry that we like to, or that we currently see as supportive of NCD prevention efforts such as taxation of sugary drinks. So it's rather concerning that a member state used this kind of language. And it wasn't just the U.S., it was also Italy, for example, who kind of echoed a lot of the comments that the U.S. made, but perhaps a conversation would be useful. I'm happy also to discuss this after this webinar in greater detail. But I think specifically in the lead up to the 2018 UN high-level meeting, it wasn't such a great sign for the U.S. to strongly oppose endorsement of Appendix III when literally all other member states were willing to go for endorsement.
Mm. Thanks, Alena. So what do you think the kind of negotiations around Appendix III mean for us when we're looking towards the 2018 high-level meeting? What do you think those discussions kind of set the scene for what we might see next year when the UN starts negotiating these issues?
I mean, I think it's not just Appendix III. I think this World Health Assembly was really quite interesting in terms of this kind of change in tone that I at least think we're seeing with the issue, for example, of industry interference being much higher on the agenda, but with specifically on Appendix III. I have to admit that when the negotiations started, I wasn't so confident that Appendix III would actually be endorsed, and I think, again, this is perhaps speculation, but it's based on some of the conversations I had with member states during the week. I did feel that as negotiations were ongoing, there was sort of this recognition from a lot of member states that not failing to endorse Appendix III was sending a very bad message about their political commitment to NCD prevention control, in particular as we're just a year away from the UN high-level meeting. So I think it's quite a strong and very positive statement that member states made, insisting on endorsement. And so for the 2018 high-level meeting, I think we probably should expect that a lot of the issues around taxation, for example, will probably come up again. But we also know now that almost all member states are broadly supportive of the interventions included in Appendix III that are much stronger than in the original Appendix III. So I think it was kind of a vote or a recognition by member states that we have seen that voluntary approaches don't really work outside of exceptional contexts such as the Norwegian context, and that for quick and effective progress for NCDs, we do need regulatory action, we do need fiscal measures in order to really move the dial on NCDs, which we're still far away from.
Great, thanks. One final quick question, Alena, then we've got to move on. So you skipped across very briefly a really important element of WHA, which was the funding issue for NCDs. So at the World Health Assembly, the budget means that we've got a 10% decrease for NCDs this year than previous years. Is that right? And how has that happened?
Yeah, it's something that I don't know what we all know that the funding situation of the WHO is not in a great place, and the WHO Director General had last year proposed a significant increase in assessed contributions from member states, and in the end we only saw a very, very small increase, and so I think the WHO had to balance out the money that was allocated across the different areas of work, and NCDs, which are largely funded by assessed contributions and not voluntary contributions from member states, took a significant hit, and the easiest way of seeing this is by looking at the program budget that was approved this year at the World Health Assembly and the previous program budget. Okay,
thanks very much, Alena. Let's move on through the WHA agenda. We've still got quite a lot to cover. So just briefly, we wanted to touch upon one of the key issues that we were really pushing during WHA, and it's been a kind of constant part of our advocacy strategy going forward, which is really around financing for NCDs, really building upon what Alena was just saying, not just around WHO's budget, but financing for NCDs more broadly. Earlier this year, we came out with a number of different organisations really calling for a global conference on NCD financing, because we really believe that we need to bring together the key government, stakeholders, institutions from across sectors to really try and crack this issue and really focus on the solutions that we've got available to us. So at the World Health Assembly, what we did with a number of different organisations, including the World Health Organization, UNDP, World Economic Forum, and RTI International, we organised a high-level roundtable on the issue of financing for NCDs. And the discussion was really broad, because what we're doing in terms of our advocacy on financing for NCDs is not to focus on one part of financing. We're looking at it from across the importance of domestic resource mobilisation front and centre, with obviously effective taxation systems being a really important part of that. Secondly, also looking at the role of development cooperation and aid, which has obviously been a real missing piece of financing for NCDs over the years, with less than 2% of $22 billion of development assistance for health currently going to NCDs. And finally, obviously, the role of the private sector and sustainable business models and shared value in stimulating appropriate private sector investment in NCD prevention and control at the national and regional level. So we organised this roundtable at WHA, which is a really rich discussion with a real cross-section of the NCD community, and importantly, some new people around the table rather than just the usual NCD crowd. What the discussion really focused on was really focusing on kind of, as I say, the solutions. What do we have in front of us that governments can really leverage in terms of blended financing streams for NCDs? It also really focused on the need for a comprehensive investment case for NCDs. What we've seen over the few years is that unlike in HIV/AIDS or women and children's health, they have a very clear global investment case, which really focuses on the return on investment in terms of lives saved, in terms of economic growth. We don't have that in a really kind of compelling packaged way. So what we've been doing is really calling for a global investment framework, which now WHO will be working on with the support of Bloomberg Philanthropies, and they're expecting to have that global investment case ready in a kind of top-level fashion by the end of this year, perhaps in time for Uruguay. And if not then Q1 of 2018. So that's a really important development for us to see that global investment case beginning to be developed for NCDs. The second part of it, which was really important, particularly from a kind of bringing the donor community into the discussion, was really focusing on how we can build upon the good practice examples that are already out there of integrating NCDs into existing global health priorities and programs around the world, whether you're talking about HIV/AIDS service delivery platforms, women and children's health services, and many other ways that donors are beginning to shoehorn NCDs into their existing programs, because so many of them aren't in a position to start a whole new budget line on NCDs at this point. And so we really wanted to kind of try and lift up those good practice examples of where that's beginning to happen and where that's working. Interestingly, based upon on our call for the need for a global conference on financing for NCDs, what we're seeing is, you'll all be familiar with the UN Interagency Task Force on NCDs that was set up a few years ago, that includes all of those different agencies now beginning to focus on NCDs, which is fantastic. Each year, the UN Interagency Task Force needs to report into ECOSOC in July in terms of what they've been doing, their activities. And what we're seeing in the resolution that's going to be going to the ECOSOC this July is actually a call for a global conference on financing national responses for NCDs in early 2018, which is fantastic. We've been really trying to look for a kind of a hook to get the mandate for the financing conference. And this may be the way that we're able to get that. And just to say that we've been talking to a lot of different governments and global health institutions and development partners about the idea of this dedicated financing for NCDs conference, and there's a lot of appetite and a lot of interest in the idea. So no doubt we'll be keeping you up to date with that, and would love to have anyone that's really interested in that get in touch with us, because the more help that we can get on that, the better. But we just wanted to provide a very short update on that for everyone. Okay, so let's move on to our next official WHA agenda item, which is the cancer resolution. So let me pass over to Rosie Tasker at UICC.
Thank you very much, Katie, and thank you very much for the opportunity to talk through the cancer resolution. Can I get the next slide, please? Fantastic, thank you very much. So I think the first things first, most important part is the cancer resolution was adopted, which is fantastic news, and thank you very much to everyone who's on the webinar who supported and helped out. All of your efforts are very, very much appreciated. The resolution was adopted Tuesday afternoon in Committee B. If anyone would like to go back and have a look at the discussions, the link in the slide there will take you through to it. As Alena said earlier, the latest versions of the text are still being uploaded. The version at the link on the line below will take you through to the latest version. There was a slight change in language, but nothing significant. For those of you who've been tracking the cancer resolution, and for those of you who haven't, there were two outstanding issues pretty much up until the last minute. These were vaccines and access to medicines. However, member states met on the Wednesday before WHA and actually managed to agree these, and so we went into the World Health Assembly with a green document, which meant all the text had been agreed. During the discussions, there weren't any major changes. There was only one slight edit proposed, and that simply integrated reporting on the cancer resolution into the broader NCD reporting, which for us works really well. And actually the document as a whole it's strong, it's comprehensive, and it runs through and identifies key prevention, early detection mechanisms, as well as medicines and technologies for cancer treatment, and makes mention of palliative care. So actually, for us, it's everything that we wanted it to be, and gives us a lot of hooks, both as the cancer community and the NCD community, to chat to member states about next steps. In total, we had 44 countries making statements, which was a lot more than we were expecting. And as part of those discussions, everyone was really positive, which was fantastic to see. And it looks like we've got about 18 members co-sponsoring the resolution. 12 of those were original countries, and you'll be able to see that on the link above. But we also had, in addition to Brazil, Canada, Colombia, Costa Rica, France, Netherlands, Nigeria, Panama, Peru, Russia, Thailand, and Zambia. We've got Congo, Malaysia, Georgia, the US, Luxembourg, and India, which is fantastic news. A couple of people have already asked us about who was co-sponsoring, so apologies for listing it off, but I thought it was easiest to do it now. We also had 11 statements from non-state actors, really kind of emphasizing the importance of this document not being a paper target and the importance of using this as a real implementation tool. And so thank you very much to everyone who submitted a statement. They were really meaningful and definitely helped to indicate the momentum behind the cancer resolution. Okay, next slide. So as I mentioned earlier, we had a couple of outstanding issues. We've had questions about what the text looks like now, so I thought it would be useful to run through these really quickly. On item 1, which is vaccines, the text now talks about promoting increased access to cost-effective vaccinations in line with the immunization targets of the Global Vaccine Action Plan. Again, for us, that's a real win. The Vaccine Action Plan talks about human papillomavirus and the HPV vaccine, which are obviously the major two. So we're really happy with that. On access to meds, this was a really thorny issue. And it was resolved by the Assembly tasking WHO to go away and prepare a technical report, which will be presented to the 144th Executive Board. So that'll be January 2019. And this is going to look at pricing approaches, the benefits and unintended consequences of a lot of interventions, incentives for research and development, and also options that might be able to enhance the affordability and accessibility of medicines. So again, this is kind of the compromise text, but I think this document, when it comes out, hopefully should be a really useful document, both for those of us working in cancer, but also NCDs more broadly, where as the burden of NCDs increases, discussions around being able to access treatment will become more and more pertinent. Next slide. So in terms of next steps, obviously now the celebrations are over, there are a couple of things we can all be doing to make sure that this grows legs. From a UICC point of view, we're going to be monitoring the development of this technical report, and again, as we expect it to be delivered in January 2019. Within the resolution text itself, it talks about WHO developing a World Cancer Report. That's going to be looking at the status of resolution implementation, the measures contained within it, and that's going to be due to be published in 2019, so obviously in the follow-up to the high-level meeting in 2018, and we'll be supporting the development of that. And again, if anyone's interested in it, we'd be more than happy to kind of share further information about that once it's available. In the meantime, we've launched a communications campaign to really use the momentum behind the resolution to drive national action. The link there will take you through to our FAQs, the press release, key quotes, and other resources, but I wanted to really quickly run you through it. If you could go to the next slide. So the whole communications campaign is really about putting the resolution out there and building momentum behind it. So we're focusing on sort of 4 key levers for change. The first one is around there needing to be evidence-based cancer plans, but also more broadly for the NCD community, that being evidence-based NCD plans. The need for better data, the need for access to treatment and care, early detection and diagnosis, and obviously prevention strategies, which is a lot of where our work kind of crosses over. So in terms of what's going on, we've released this package of materials. We'd really, really encourage you, if they're relevant, check them out, and feel free to pick them up and make them your own. Use them to support the work that you're taking place. And if we can go to the next slide. As part of this, we've developed a whole series of quotes. The text may be a little bit small for you to read, so I do apologise. But essentially, they're looking around how different communities can pick up the cancer resolution and use it to further your own advocacy work, and also tie it into the broader global momentum. We'd really love to work with you, everyone on the call, to kind of develop your own quotes and images to help drive this national action. If you've got any questions, please do send an email to advocacy@UICC. I do apologise, I've slipped off including it in the slide there. But these quotes will be going out over the next few days, so check out the UICC social media and Twitter in particular. And yeah, we're here if you've got any questions.
Great, thanks Rosie, and congratulations to UICC for all of your advocacy work in the lead up to the cancer resolution. It's great news to see it go through. A couple of brief questions. So we've got one from Lena Mahi to ask, obviously you mentioned some of the kind of thorny topics of the cancer resolution were more on the treatment side of things. Is there much in the resolution on the prevention side of cancer, particularly around kind of healthy diets, breastfeeding, and the role of food in the prevention of cancer? And then the second question is, what does this resolution mean in terms of how WHO will be addressing cancer? I mean, will there be more funding for cancer within the WHO NMH department, or how will that look like, do you think?
Both incredibly good questions. On the prevention side, there are quite a few. There are hooks in there that we can use to explore the prevention pieces. There are very few kind of specific languages, for example, around breastfeeding. But from our point of view, we hope that there's enough in there to enable people to kind of identify the subparagraphs which are most relevant for you. They do talk about needing to the need for there to be kind of comprehensive prevention mechanisms, and actually, given the number of references through to things like the Global Vaccine Action Plan, but also the Global Action Plan on NCDs, there are very few specific references, but it refers through to those documents. So we've got those links. So hopefully that's enough of a hook to be able to keep this moving. On the funding piece, that's a really good question. There is talk around using this as a funding opportunity, but there's nothing pledged or promised. I think for us as we move forward, using the cancer resolution and the evidence importance that member states put on it is a really good tool, but I think we need to engage with all the work that you were talking about, Katie, on the financing for NCDs to really help make the case. I think the cancer resolution on its own probably won't be enough to pull significant extra funding into WHO to support the NMH cluster.
Mm-hmm. Great. Thanks, Rosie. And for those that haven't seen the communications campaign materials, I do suggest going to check out the UICC website, because there's lots of really useful resources there in terms of obviously taking forward the resolution and supporting implementation at the national level. Thanks, Rosie. Let's move on from cancer to rheumatic heart disease. So Joanna, over to you at the World Heart Federation to talk about the RHD resolution at the EB, which happened immediately after the World Health Assembly.
Thanks, Katie, and thanks to the NCD Alliance for giving us a spot on this webinar to run everybody through some updates on the rheumatic heart disease work we've been doing at WHO and with member states. So on a similar vein to the cancer resolution, the World Heart Federation and lots of partners, including NCD Alliance and RHD Action, have been working on a sort of similar looking piece of policy to coordinate and sort of authenticate the WHO's work on RHD. If we could move to the next slide, please. And even the one after that. Lovely, thank you. So for those who aren't familiar with rheumatic heart disease, it is a cardiovascular disease that affects 33 million people today in all regions of the world, covering all 6 WHO regions. RHD causes 275,000 preventable deaths a year. And while those numbers may seem small in comparison to the wider cardiovascular disease mortality burden, what's really compelling and what really drives us at the World Heart Federation to tackle this disease is the fact that it's women, children, adolescents, and very often young pregnant women who are disproportionately affected. This really is a disease of inequity because countries such as the North American countries and the Western European countries managed to eradicate rheumatic heart disease. It's really rarely found nowadays, and that sort of drop in disease burden happens through very achievable things: access to primary care, cheap and easy prophylaxis with penicillin, really basic cheap drugs. But for reasons of equity, lack of political will, there hasn't been this progress in lower middle income countries and in more marginalized pockets of higher income countries, such as among indigenous populations. So that's just a very quick whistle-stop tour of what rheumatic heart disease is. It very much fits in the NCD family, but it is quite a complex disease in that it is communicable as well as non-communicable, and it does have these very strong sort of spokes out to the maternal, child and adolescent health arenas. The WHO did have a sort of centralized, coordinated program of action for RHD, but that sort of petered out in the early 2000s. So until sort of this point, there's been no global policy on RHD, and there's also been no secure funding. Please can we move to the next slide? Thank you. So what we've been doing over the last few years is working with governments led by New Zealand to create the sort of first global commitment on RHD, and we wanted this to come in the form of a World Health Organization-led resolution. And you can see from the picture, there's a sort of main clump of countries that came forward and worked to draft this text. It's very short, about 3 A4 pages, but it's quite important for us. It's the first time governments have really set down their priorities and acknowledged rheumatic heart disease as a global health issue worthy of global level attention. So next slide, please. So it's been quite a long process to get to this stage. Where we're at now is at the Executive Board meeting in Geneva, which happened right at the sort of tail end of the World Health Assembly. The resolution draft was discussed and debated by all members of the World Health Organization Executive Board and other member states who've been involved. So to get up to this point of governments convening to talk about this key text, it's taken about 30 months of work from governments and also from us and our civil society partners to sort of reach a text that we can all live with, we're all happy with. Then the discussions at the Executive Board meeting lasted about 4 hours. We had 36 governments make interventions. So like Rosie was saying, that she was surprised by how many governments really felt passionate and felt compelled to speak. We had a very similar situation of the nice surprise of how many governments and ministries of health were really feeling quite passionate about this NCD issue. Of those 36 governments, 20 have come forward to officially co-sponsor this resolution. So that's adding to the list of countries you saw on the front page. Within the resolution, it's quite streamlined, quite straightforward. 5 recommendations are for member states. Most of them are around scaling up national action or starting it if they haven't already. 5 recommendations come for the WHO. Most of that is about convening, also mobilizing resources. And there are also 3 action points for us, for civil society. And they really speak across the NCD space to things that we all care about, whether we have a risk factor approach or a disease-specific approach. You know, these actions are for us to make sure that patients and carers and health workers are really at the center of this response. We are asked to spread the word widely and make sure that we're connected in with other areas of health, global health and public health. And also to help keep governments accountable and to make sure that spending happens properly. So it's a streamlined document, but with some quite clear action points that are specified to each group that's going to be involved in getting this resolution implemented on the ground. So the next steps, if we could have also the next slide, please, is for this draft resolution, which has been recommended by the WHO Executive Board for formal adoption, sort of ceremonial adoption, at the World Health Assembly next year. So this is where we're at now. Our sort of short-term aim is to make sure that when the World Health Assembly comes around, member states are primed and ready to endorse the resolution text as it is. There were some minor changes put forward by some governments during the Executive Board meeting, which were really constructive, and we were generally quite pleased with them. But we're happy with the text as it is. We're hoping it can be endorsed without opening up the sort of individual lines of policy that it contains. We're also very keen in the short term to make sure that the funding commitments that have been proposed for rheumatic heart disease are honoured. And this is going to be important across the NCD space, because if governments fail to be accountable for the amount of money that they have at the moment sort of given a draft pledge to for RHD, that sets a terrible precedent for their funding of NCD work in the future. So we're going to be really taking them to task on that. So at the moment, the figures being bandied around are $13 million over the next 6 years. So it's really not as much as we were hoping, but the duration of the commitment is quite encouraging, that this hopefully won't be something that WHO throws a bunch of attention at for a couple of political cycles and then just steps back. We're really hoping this can be part of a sustained and forward-looking sort of branch of the NCD response, the wider response. So sort of mid-term, after we've reached May and hopefully achieved our goals there, we'll be moving from this sort of policy planning into implementation. And for this, the main word for us is accountability. Governments will hopefully have set down their commitments on paper, and we need to make sure that these translate into action in real life. So we are now, the World Heart Federation and all our partners are sort of taking stock of what's happened over the past week. It's been a big week for us. And we're now sort of shifting our focus into this sort of more strategic implementation phase. So part of our work is going to be identifying member state champions, for example, who can be a really good example of good practice at the regional level, so that countries can see that rheumatic heart disease prevention and control is feasible, it is affordable, and it's entirely possible as long as it's approached in an efficient and sort of people-centric way. So there are many, many ways that our friends, colleagues, partners across the NCD space can get involved if you're interested. We do have a campaign, the hashtag Time to Tackle RHD campaign. This campaign's been quite sort of policy-focused up till now. It's been really directed at the country delegates and the governments themselves. We're going to try and turn this into more of a public-facing campaign, one that sort of embraces in a much more encompassing way the wider NCD space environment and, of course, all of our colleagues there. When it comes to the World Health Assembly, we will be thrilled if any one of you feels compelled to make a statement during the agenda item in which RHD is discussed. it would be great to have a loud civil society voice on this that really shows that RHD is just one of many NCDs that needs more attention and a more collective and coordinated response. So if you're interested in that opportunity, please do reach out to me via the World Heart Federation. All of our information is on our website. And finally, we're super inspired by everything that's been going on in the dementia space, the cancer space, respiratory health space in terms of policy. We'd love to learn from you guys if you think that there are any tips that we would find valuable as we move forward. This is quite uncharted territory for us. So we'd be really keen to have a conversation with you about this. And of course, if there are any questions, I think there's some time for Q&A right now. So thanks again for your attention. Thanks to NCD Alliance for the opportunity.
Fantastic. Thanks, Joanna, for that. And congratulations on your 30 months of civil society strategizing and campaigning. It's a great result, and obviously we at NCDA will be supporting the passage of the resolution through to the World Health Assembly next year. We don't have any questions coming in at the minute. I always have some up my sleeve. So obviously, as you said at the beginning, RHD is really a kind of an issue of inequity and social justice in many ways, and a real sustainable development issue. I'm just wondering, through your advocacy and campaigning over the last 2 years or so, how much of the development community have really come into this, and how much they've been taking on the issue of rheumatic heart disease as well?
Thanks, Katie. Great question. I think if I compare this to other branches of cardiovascular health, it's a bit sort of artificial to be dividing heart disease up into all of these sort of clusters, and really they're an all-encompassing whole, much as the NCD umbrella can be. RHD is seen quite differently, I think, from the sort of wider development community's perspective, partly because of the sort of demographic of people who are worst affected, and partly because, just going back to that, so it's women, it's children, adolescents, it is young pregnant women who don't have access to care. So I think that for sort of humanitarian reasons, there is interest there, and we're starting a great collaboration with the IOM, for example, who are sort of trying to weave the strands of rheumatic heart disease into their migration response. So that's been a great learning experience for us. But I think as well as the demographic of people who are living with RHD and who have their lives affected by RHD, one message we found very helpful when talking to colleagues who work in the wider development space, so Médecins Sans Frontières and Save the Children, is this very close link to the social determinants of health and the environmental determinants of health. So rheumatic heart disease is highly correlated with growing up in conditions of poverty, bad housing, overcrowding, poor sanitation, which I know the environmental factor is a cross-NCDs issue, especially for colleagues in lung health, for example. So sort of by acknowledging that and having that quite a sort of the rhetoric of that at the forefront of our response, we've been able to engage some parties that have been traditionally a bit more reluctant to share work and share space and a platform with cardiovascular disease. So that's been really helpful for us, and we're definitely open to more partnerships and sort of widening out this discourse as much as we can.
Great. Thanks, John. And as I say, it's great to see RHD really beginning to gain political traction from our side as well. So congratulations again. So let's move on to our final agenda item, which is again a fairly brief update. So we've been talking about the WHO Global Conference on NCDs quite a bit. Next slide, please. So what happened at the World Health Assembly is that the global conference was formally announced at WHA to governments. As a reminder, this is on the 18th to the 20th of October this year in Uruguay. Most importantly, it's being hosted by the president of Uruguay, Tiberi Vázquez, who, as Alena said, is in Geneva for the next couple of days, who's obviously a real champion of tobacco control and NCDs more broadly. So it's really great that a head of government, head of state is really taking on the NCD issues and convening this important conference. What it will do is it will bring together heads of state, heads of government, ministers of health, but also, importantly, ministers from other government departments, WHO, UN agencies, civil society, academia, and relevant private sector. At the moment, what we understand is that there will be kind of 3 different segments of the conference, that there will be a high-level segment, which will be the heads of government, heads of state segment. There will be a ministerial segment, and then there'll be a dialogue which will be multi-stakeholder. It's almost similar to the Moscow ministerial conference that was held back in 2011, for those of you that were around for that one. And obviously this is really gearing up to be one of the key preparatory meetings in the lead up to the 2018 UN high-level meeting on NCDs. We understand in terms of who will be invited, it will take a similar shape to some of the dialogues that the Global Coordination Mechanism has organised in terms of who will be able to attend, i.e. organisations either in official relations with WHO or who are participants of the GCM. But that is still to be determined, and obviously we'll keep everyone up to date as we get more information on the registration process for the conference. In terms of what it's focusing on, the theme is really around policy coherence across sectors to reduce NCD prevention and control. So it's really looking at, focusing in on NCDs in the circle of that web of the Sustainable Development Goals, and making those linkages between nutrition, environment, agriculture, economy, gender equality, etc., etc. So policy coherence is the main overarching theme. What else to say? That the most important, or one of the most important parts of it, is that it will result in an outcome document. We understand that this outcome document will be negotiated in Geneva through the missions there in Geneva, obviously being steered by the Uruguayan mission in Geneva, with all governments having the opportunity to engage. And then it will be formally adopted at the actual conference by governments in October, probably at the high-level ministerial segment. And actually there's a meeting in the next couple of days in Geneva with a small number of experts to really try and help flesh out the skeleton of the outcome document, as it were. But as I said, because this is being seen as a key feeder meeting into the 2018 UN high-level meeting on NCDs, we're viewing this outcome document as really important, because as many of you who were there for the Moscow Ministerial Conference will remember, that outcome document from Moscow was a really important foundation for what was then adopted in New York the following year. So WHO have now set up a website, so we've included the link there for more information. They've now got a brochure out on the conference with a few more details. But I think that's about it at the moment in terms of what we know. And obviously as soon as we get more details, particularly around the registration and how civil society organisations can get involved in that, both in terms of the lead up and then obviously at the conference itself, we'll let everyone know. But just to end on the point that it's going to be it's an important calendar for everyone's. It's an important date for everybody's calendar. Sorry, because it is a real feeder meeting for the 2018 high-level meeting. I think that's it from the Uruguay conference. Next slide, please. I don't see any questions pouring in, unless anyone has any sudden urgent questions that they would like to pose in the chat box for now. If not, obviously please email info@ncdalliance.org for questions around it, or obviously one of the team is more than happy to answer. And as I say, we'll be constantly updating everybody on Uruguay as we go. Just to end on the fact that, thanks to all of our speakers for a really great webinar with lots of interesting information. On this webinar, we obviously only touched upon the official agenda items, and just to flag, as Alena said right at the beginning, there were 26 NCD events. I think that's a record for WHA. And I think what was really interesting this year for WHA was that the events were spanning so many different issues. It wasn't just the usual kind of NCD pure focus. It was on financing, it was on access issues, it was on humanitarian settings, it was on comorbidities, air pollution, women and children's health, commercial determinants of health. The list goes on. So a really, really productive and exciting WHA for the NCD community, I think. So thank you to all our speakers, and thank you for everyone for joining, and we'll be holding the next webinar in 6 weeks or so. Thank you, everyone. Goodbye.
And that concludes today's webinar. Thank you for your participation, and you may now disconnect.